Welcome back again. We're continuing with our day. We just finished our liposuction. We are doing abdominoplasty on this young lady. Also, breast augmentation and liposuction of the arm. And basically, for the breast augmentation, I am actually going to put the implant from the incision in here, so there won't be any scar in her arms or her breast. So I'm going to go over this drawing. It's very important what this needs to be done is because she does have the curvature, and we want to exaggerate this curvature, and we call it corsetplasty. So what we do is sort of upper abdominal tuck, which we bring this thing down, and we call a lower body lift. So we're sort of lifting the bottom part as so the mons sort of coming out to where it was before she had the babies, and also on this end. So we're going to pull the lateral thighs up, we're going to pull the mons up, and we're going to pull this up, and then we're going to pull this. Closure of the muscle on the side we will show inside the operating room, but it will be here and here as well as laterally to give her a sort of a corset to exaggerate the curvature, and I will show that during the surgery when we're inside, and I will actually show the abdominal pannus that we're taking out. So what I like to do, I normally pull this up to give it a pull look. You want to feel for the bone. On Latinos or Hispanic, you don't want to go too high, because when you pull this down, pull this up, the incision ends up high. So you want to stay low. So when you're pulling this up and pulling this down, this incision stays low. So I am pulling high, and I'm actually doing my drawing. Now when you do this, when you let go, I normally write a straight line, and when you let go, you can see you can have a little, basically very small shape bent line. Depending on the hairline here, you can see how the hairlines are shaved. That's how far I go, because generally that's the line of the bikini. The hairline goes higher, then I go a little bit higher, because this is what's going to make me bring it in. Now at this point, we want to basically, again, see what I'm doing? I'm lifting up as I'm drawing, and I'm staying on top of the pelvic bone. And then same way on this side. Now, drawing is very important in abdominoplasty. I have many patients that come in that we do their redo abdominoplasty, and they're sort of wondering why we spend so much time drawing before. And they said normally their last surgery, nobody did the drawing. I think drawing is very important. Take your time in drawing this out, because once she's under and you put some fluid in there, you really don't have any reference point. Now, so basically I measured this out to be about 14 centimeters, so 7 centimeters for both ends. I like to measure this out at the same time, so both angles would be the same. So about 21 centimeter at this level, and about 21 centimeter I'm so sorry, so yeah, at this level. So and then you want this angle obviously be almost the same, and when you're eyeballing it, they're almost the same. So you can see the incision is sort of going down. So the question is, would it stay this way? Not really, because when I'm cutting in here, I don't do the typical sort of curved down shape. I actually do what's called the lateral tension lift. I go up here and I bring this down. So, and I'll show you how that's done. So in this patient, I'm pretty sure I can pull down all the way down to the belly button. So I'm actually going to draw the line of 7 centimeter that I have here. And we're pulling it all the way down, just like the 7 centimeter we had down there. Again, the reason I'm drawing this vertical lines is because, again, when you're in there, all your marking all your zones are gone, and all you have is your marking. So we have 7 centimeter in here. Now this is a tricky part. I want you guys pay attention. So 7 times divided by 3 is 21 divided by 3 is 7. So I actually go to 7 centimeter and I put my mark over here. This is where I want to lift up. Now, the question is, then at this angle, most people will bring this down. But if you bring this down, the tension here is not as much as here. This here is going to have a lesser tension because you're bringing this up and you're bringing this down. And sometimes doctors compensate by going into the leg, which we all know it's a terrible mistake and it heals terribly. So at this angle, I am actually going to angle it up the same angle as here. Are you following me? So basically, instead of going down, I'm actually going to go up here. Now, a lot of people are concerned, oh my God, you're on basically her first rib, but we're releasing everything in here. And at this point, it's going to go to this point. So what we call this angle. See what I told you about pulling it down? And this is what I wanted to do. So I have this 7. I'm actually going to give this to about 9 on this part, because generally when you're pulling it down, this angle is always want to be pulled more. So I have 7 here. I normally go about 2 centimeters above that. 9 on the upper side. And I'll put my mark in here. Now, again, follow me how we do the last part. So this is where my end result is. So I'm pulling it in, and from this way, I'm actually going to go straight down. Now, when you let go, again, you have a little elliptical shape there. And generally, you might have a little extra over here, and then you might extend it out. So I always mark my mark in here so I know where I am. And if I need to, I just bend it out. But you try to not to, obviously, right? So do the same thing on this side. Okay, are you following me, Diana? There you go. So we got 7 centimeters in here. Same thing. I'm going to go at the same angle as this is going up. So you're following me, right? Because if I go down, the tension here is going to be less than here, and hence a lot of time patients do tummy tuck, they have looseness on the side because the tension is high, is lower. So I'm going to go to about 9 centimeters on this end. I'll put my line and then pull it in like, no, don't lift yourself up, because I want to give it a nice tuck, and then pull it back from this end over. So there you go. So to go over everything, we have about 14 centimeters of line here, 14 centimeters here. You pull up when you make your incision, and then about a lateral incision going out, basically 7 centimeters about, right? Generally that translates into where the hip bone is, and you're pulling it up at this angle. This will come to here. Trust me, a lot of time patients says, or doctor says, how you can pull this over here? It will come if you release everything in here. If you don't release, then you might have a little problem. But remember, release here, not too much in here, because we have vasculature over there. So again, I am doing my marking on the areas that I want to do. And then once we take this out, we're closing the muscle from the same way we put an implant. And we will show that during the surgery exactly how it goes. And my lovely lady can get a copy of it too, so she can actually see what her muscles look like inside. All right, so we are good. Thank you.